The Newsom California Plan to provide health care contradicts the RFK Junior plan to deny vaccine and care. Newsom has positioned himself as a national public health leader by staking out science-backed information wealth. With some blue states that join him, Newsom is on a team with fellow Democratic governors Tina Kotek of Oregon, Bob Ferguson of Washington, and Josh Green of Hawaii as allies. The West Coast Health Alliance, original public health agency whose guidance the governor said would uphold scientific integrity in public health as Trump destroys the CDC's credibility. Newsom argued establishing the Independence Alliance was vital as Kennedy leads the Trump administration's rollback of national vaccine recommendations. More recently, California became the first state to join a global outbreak response network in coordination with the World Health Organization, followed by Illinois, they plan to join the network. The Trump administration announced that it would claw back more than $600 million in public health funds from California, Colorado, Illinois, and Minnesota, arguing that the Democratic-led states were funding woke initiatives that didn't reflect what White House prefers. Within days, the state sued and a judge temporarily blocked the cut. They keep suddenly canceling grants and then it gets overturned in court, said the executive director of the Health Officers Association of California. A lot of the damage is already done because counties already stopped making the effort. California is part of a coalition suing the Trump administration over its decision to deny recommendations for 7 childhood vaccines, including for hepatitis A, hepatitis B, influenza, and COVID-19. There is an uptick in measles, we're sliding backwards. Hawaii state epidemiologist said Hawaii joined the alliance after hearing from scores of pro-vaccine residents who wanted assurance that they would have access to vaccines. We were getting a lot of questions and anxiety from people who did understand science-based recommendations, but we're wondering, am I still gonna be able to go get my shot? Other states, led mostly by Democrats, have also formed alliances with Pennsylvania, New York, New Jersey, Massachusetts, and several other East Coast states banding together to create the Northeast Public Health Collaborative, influencing red states. Newsom in his state has approved a recurring annual infusion of nearly $300 million to support the state Department of Public Health, as well as the 61 local public health agencies. There's a slate across California, and last year signed a bill authorizing the state to issue its own immunization guidance. It requires health insurers in California to provide patient coverage for vaccinations. The state recommends, even if the federal government doesn't. A spokesman at the Libertarian Cato Institute said decentralization can be beneficial. That's because local media campaigns that reflect different political ideologies and community priorities may take a better chance of influencing the public. Some red states are joining blue states in decoupling their vaccine recommendations from the federal government. Some doctors in Arizona are looking to keep Liberal California for vaccine recommendations. Science is never settled, and there are a return to even areas of this country with different opinions. Challenge our assumptions and learn.